In today's video, we'll go through the 10 most significant mental health conditions of our time. Mental health issues are much more prevalent as you might believe. According to the National Institute of Mental Health, almost 1 in every 5 Americans may suffer from a mental condition at a certain stage in life, particularly anxiety and depression being the most common. Even yet, most people are confused what to do if they are due to a mental health problem. In today's video, we'll go through the 10 most significant mental health conditions of 2024. Here is some information about the year's most documented mental conditions, most of which are also quietly and painfully suffered. Anxiety. Anxiety is a common mental health issue that affects 1 in 5 adults. It can be triggered by stressful situations like being on the road and having to drive yourself through unfamiliar territory. Anxiety disorders are treatable with medication and therapy, but if left untreated, they can lead to depression and other serious health problems. If you've been dealing with anxiety for some time now, we've got some tips on how you can get better. Talk to your doctor about medications that may help your symptoms. Some medications work well for one person, but not another. This is why it's important for everyone who has ever felt nervous or anxious, or any other mood disorder, to speak up about their experience so that doctors know what type of treatment works best for them individually. You might want to try something like an antidepressant drug first before taking anything else, since those tend toward less side effects than anti-anxiety drugs such as Valium or Xanax, and those come without prescription costs either. If all else fails though, then maybe consider seeing a therapist instead, since these folks are trained specifically at helping people cope with stressors directly related specifically towards reducing anxiety levels over time. Depression. Depression is a common mental health problem that can lead to severe consequences. It's characterized by feelings of sadness, loss, and hopelessness. People with depression also have trouble thinking clearly, managing their emotions, and making decisions. The symptoms may last for weeks or months at a time, but don't go away on their own. Depression is more than just feeling down. It's an illness that affects your ability to function normally in every area of life. Work, school, or family life. Depression has many different types, including 1. Major depressive disorder, MDD. 2. Dysthymia, a less severe form of depression. 3. Bipolar disorder, manic depressive illness. 4. Seasonal affective disorder, SAD. Schizophrenia. Schizophrenia is a long-term mental disorder that causes abnormal thinking and behavior. It can affect people of any age, however it most commonly occurs between the ages of 16 and 25. Schizophrenia symptoms include 1. Delusions, false beliefs about things that don't exist, such as seeing or hearing voices. 2. Hallucinations, seeing or hearing things that aren't real. 3. Disorganized speech, losing track of what you are saying. If you think you might have schizophrenia, your doctor will ask questions to find out more about your symptoms and health history. Your doctor may also want to see other doctors for help with diagnosing the condition. If a diagnosis is made, treatment options will depend on how severe your schizophrenia is, and whether it's affecting other areas of your life like work or school attendance. Bipolar disorder. Bipolar disorder is a mental health condition that causes extreme mood swings. It's also known as manic depression and can cause severe emotional distress and interfere with day-to-day life. Bipolar symptoms include 1. Changes in energy level or activity, e.g., being very high one moment and very low the next. 2. Unusual behavior, including rapid speech, pressured speech, reckless driving, or other risky behaviors, e.g., substance abuse. Dementia. Dementia is a loss of memory, language, and other mental abilities that affects a person's daily functioning. It is not a normal part of aging. Dementia can be caused by many things. 1. Alzheimer's disease, AD. 2. Vascular dementia, VAD. 3. Frontotemporal dementia, FTD. 4. And Lewy body disease, LBD. In addition to memory loss, people with dementia may also experience changes in their behavior such as irritability or aggression toward others, confusion, difficulties recognizing familiar people, or places trouble understanding speech or writing because they cannot see well enough to read words on the page, wandering around aimlessly, without purposeful activity, or declining physical health due to loss of appetite due to pain from incontinence. Eating disorders. Eating disorders are a serious mental health issue that often go undiagnosed and untreated. Eating disorders can have both short-term and long-term effects on your life, as well as cause you to miss out on important milestones like college graduation or starting a family. The most common types of eating disorders are 1. Anorexia nervosa, AN. 2. Bulimia nervosa, BN. 3. Binge eating disorder, BED. 4. Overeating disorder, OD. Anorexia nervosa is characterized by an intense fear of gaining weight or being fat. Someone with AN will restrict their food intake in order to keep their body weight at or below 85% of what it should be for them, size-wise, at age 18 or 19 years old, depending on gender, because they believe that this will help them look better if they're not overweight. Overweight while still maintaining a healthy body image, regardless if they've gained any weight since high school graduation from modeling class, where you learn how important it is for models who want careers in fashion industry like runway shows, etc. Post-traumatic stress disorder, PTSD. Common symptoms of PTSD include 1. Avoiding things that remind you of the trauma, such as avoiding seeing or hearing about it. 2. Feeling detached from others and feeling like a different person than before the trauma occurred. 3. Diagnosis is based the symptoms following an exposure to traumatic events, such as being involved in a car accident, witnessing an accident or being trapped in an earthquake, experiencing violence at home or elsewhere, experiencing sexual assaults, having military experience, such as combat, or experiencing natural disasters like floods. 4. You should also be able to describe how these events affected you emotionally or psychologically after they happened. Treatment options include therapy sessions where you talk about what happened during the events leading up to diagnosis. Some people find relief by talking about their experiences with friends, family members who have gone through similar situations. If this doesn't work well enough for some people, then more intensive treatments may be appropriate depending on individual circumstances. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder, OCD, is a mental health condition that causes you to have unwanted and repetitive thoughts, behaviors, and/or impulses. People with OCD may not know they have the disorder until someone asks them about it. OCD is characterized by obsessions, unwanted thoughts, and compulsions, repetitive behaviors. The main symptom of OCD is the repeated appearance of intrusive thoughts or images that cause distress and prevent people from performing normal daily tasks. For example, if you're thinking about germs on a public bathroom door handle while washing your hands, because you don't want anyone else coming into contact with them, that would be an obsession. Other common obsessions include 1. Contamination fears. 2. Having sexual thoughts about people other than your partner. 3. Being afraid of losing control over something important in life like money or relationships, and so on. Borderline personality disorder, BPD. Borderline personality disorder, BPD, is a mental disorder that causes severe emotional distress and behavioral problems. It's characterized by a pattern of unstable relationships, mood swings, and self-destructive behavior. In fact, BPD is the most common personality disorder in the United States, and it affects about 1% of adults at any given time. Symptoms of borderline include 1. Feeling empty inside. 2. Being easily hurt. 3. Difficulty controlling anger. 4. Frequent mood swings. 5. Impulsive behavior such as spending sprees. 6. Or unprotected sex with many partners. ADHD and ADD. ADHD is a neurodevelopmental disorder that can affect both children and adults. It's one of the most common mental health issues in America, according to the Centers for Disease Control and Prevention, CDC. ADHD affects about 7% of American children and teens, while another 4% experience it as adults. It's estimated that 1 out of every 10 people has an ADHD diagnosis by age 12 years old. Symptoms include 1. Inattention. 2. Hyperactivity, impulsivity. 3. Disorganized behavior. 4. Disruptive moods. 5. Trouble maintaining focus. These symptoms occur often enough to interfere with functioning at home or school daily life tasks such as completing homework assignments without being asked twice, being able to switch between tasks quickly without losing focus on what needs done next, seeking reassurance from others when something goes wrong instead of trying again, because you know how important it is not just finish everything perfectly first time around. Unfortunately, mental health problems are more common than you might think. Mental health issues such as depression, anxiety, and stress are more likely to occur in people who experience other physical illnesses. In fact, about 1/3 of people with a mental illness also have another diagnosed condition such as diabetes or heart disease. Those who live with someone with a chronic illness may be at higher risk for developing their own symptoms of anxiety or depression, because they feel responsible for helping their loved one manage the symptoms of their illness. Communicating accurate information helps in raising awareness on mental health. If you believe you are currently struggling with any of the issues described previously, please seek treatment or reach out to someone in your community who might be able to support and guide you. The far more essential factor is to feel comfortable speaking about whatever is bothering you so that others could offer support and help as needed.